So today I'm interviewing a different kind of medical provider. I have the utmost pleasure of interviewing Dr. Stephanie Rothenberg, who is an obstetrician and gynecologist who works at Pacific Northwest Fertility and specializes in providing care specifically to transgender and non-binary individuals who are seeking family planning services, like sperm freezing or egg freezing. Thanks so much for taking the time to do this.
No problem. No problem. It's my pleasure. Yeah, I checked out some of your videos. It's amazing what you're doing. I love it.
Yeah, thank you.
Yeah.
Yeah, you'll be the first person I've talked to specifically about this topic, like
Awesome.
fertility and family planning, because I
Cool.
wasn't even aware that there were people that were specifically focusing on
Yeah.
like LGB, especially trans issues. So
Yeah. Yeah. Well, I'm glad that you found us.
yeah,
Yeah.
I don't even
I
remember
know.
how
How
I
did you
did.
find us?
I don't know. I had done a video like a while back on my experiences with like sperm banking, and I
Yeah.
think I was like looking at stuff to like maybe like do a new video, and then
Yeah.
I don't know, somehow
Yeah.
the Pacific Northwest Fertility showed up in my search, and I'm like, ooh, what's this? And
I
just kind
love
of went
it.
from there.
I love it. That means that our media people are doing the right thing, that we're coming up on your
Yeah.
search. Love it.
So if you're
My
ready
pleasure
to
to chat
jump,
with you today. Yeah.
yeah.
Just let's jump in. Let's do the thing.
Yeah, let's just start very broad. Can you tell me a little bit about like your life
Yeah.
path and what brought you to, obstetrics, gynecology, endocrinology, and all that?
Yeah, absolutely. So I grew up in Washington State, and I always knew that I wanted to be a doctor. And I was an athlete, and so I was like, oh, maybe I want to be an orthopedic surgeon, like work on knees and hips and stuff like that. And then I started working with kids who had cancer and did like a summer camp. So we had like a medically supervised summer camp so that these kids could like feel normal, even though they were in the midst of their cancer treatments. And I was like, okay, I want to be a pediatric oncologist. That's what I want to do. So I started medical school. And one of my friends who was also like a camp counselor with me had chemotherapy when she was a kid and wanted to have a family. And she was like, I don't know if I can have kids. Like I had all this chemotherapy, my periods are all weird. And I was like, I have no idea. I'm a med student. I don't know anything. So I started looking into it and I got into the world of like oncofertility and fertility preservation for people who have had cancer treatment. I was like, this is what I want to do. How do I do this? And I was like, okay, so I need to be a reproductive endocrinology and infertility specialist. That is a mouthful. And then I'm like, okay, how do I get to that? Oh, I need to be an OBGYN. And I was like, oh man, I never had any intention of being an OBGYN. So I kind of had my whole plan like laid out for me and I never deviated from it. So I went to medical school at the University of Washington and then I did my OBGYN residency at the University of Pittsburgh. And then I did my fellowship at the University of Pittsburgh. So I'm an OBGYN, but I'm also an REI or a fertility doctor. So, but I don't deliver
Okay.
babies anymore.
So are you
That was
originally
kind of my path.
are you originally from the Northwest? Because
Yeah. Yes,
okay.
I am. I am. So my parents still live in Washington State. We like moved around a lot. So
Okay.
yeah, I'm a citizen of the Northwest for sure. So how I got into trans care. So let me talk about that. So, my focus was on fertility preservation and you start talking about fertility preservation for cancer patients. And you're like, wait a minute, there are all of these people who are going through medical treatments that has nothing to do with cancer. So like sickle cell anemia, they're having bone marrow transplants. And then it's like, oh my gosh, all of these trans patients who are like going on hormone therapy. And I'm like, what about these patients? And so I started to get really passionate about it when I was a fellow, and we started to have patients come through. And Pittsburgh actually has a really active trans community. And so just started working with them and getting really involved and just kind of advocating for patients and developing a couple different programs and just trying to make it more like trans and non-binary friendly. And yeah, I was like, this is my thing, man. I love this. This is just, people who need my help.
Yeah.
And so that's how I got into it. It kind of fell into my lap a little bit.
Yeah, I
Yeah.
love all of that.
Yeah. Yeah. Yeah.
Yeah, and I love that like the work you do and the work that Pacific Northwest does like specifically advertises that you provide
Mhm.
those services for trans people. So I know
Yeah.
like my experiences in Florida, like, I had to get referred from my endocrinologist to go, and then like their website
Yeah.
had nothing about trans people.
Yeah. Yeah.
And it was just like very weird because
Yeah.
I was like very early in my transition. I was the only person who was like male presenting there, and I'm
Wow.
just like I feel
Wow.
very out of place here. But
Yeah.
they're
That's,
thankfully very supportive once I actually see
yeah.
the doctors.
That's so interesting because one thing with like our clinic is that we constantly have like I see men and women all the time. So there's really kind of not this like gender specific, like, oh, like if you're, male presenting in my office, then you must be trans. And I think that we do so much LGBTQ care too, that it's like, we have couples all the time who are like gay cis men who are building their family and using, a surrogate. And so it's in our office, it's certainly not, it wouldn't be odd for you to come to see me as like if you're like male presenting. It's just like
Yeah.
part of the care that I provide.
If only I wasn't in the opposite end of the country at the time.
I know that I think that does have a lot to do with it, right? Is like
Yeah.
Seattle is just like a different environment than if you were in like Atlanta or Florida or compared to like LA or San Francisco.
Oh yeah. That's one of the reasons why I think I eventually want to go out to the West Coast. Just
Yeah, come on,
I've
here.
never, and I've only visited a few times, but I'm thinking like for my psychology internship, I'm gonna look at sites out
Yeah.
there.
Oh, you
So,
totally should.
so speaking of, getting more into the fertility preservation specifically
Yeah.
for like, trans men, trans women, non-binary people. I've seen that you've done a little bit of published research
Yeah.
related to that. I was wondering if you
Mhm.
could tell me a little bit about like some of that research
Yeah.
that you've done.
Kind of my first trans related publication that I had was actually in the New England Journal of Medicine. It was just a case report. And it's really, so what a case report means is that it's just about one patient, so like something unique. And it's really hard in medical literature right now to get a case report published. They want things like big randomized trials, like, but what case reports are for is to just like introduce something that like people haven't really done before, or even thought about doing. And so we got lucky a little bit to get it published in such a prestigious journal, but it was about, we had a patient who came to see us and he was 16 and he had started a hormone blocker early in his puberty. So he had not finished female puberty and he really, really, really wanted to freeze his eggs. And so he'd been on a blocker for a couple of years and was getting ready to start testosterone therapy. And we can talk about a little bit more about timing, but ideally you want to try and freeze eggs or sperm before you start testosterone or estrogen. And so he felt really strongly about it. So one option is that we could stop his blocker and he goes through female puberty, which is like, he was like, and we were like, that sounds terrible, right? And he's also really young, so still has a lot of dysphoria and hadn't really started all of his transition. He wasn't further along and kind of comfortable in his skin, so it was really challenging. So we decided, let's just try to freeze eggs without stopping your blocker. His family was super supportive, and we said, basically they were able to say like, okay, we can gamble this money that you might not get any eggs, which is not a position that very many people are in, say, because we'll talk a little bit about cost, but it costs about $15,000 to freeze eggs, right? So it's a lot of money for like a gamble, right? So had this amazing family and we're super supportive of their kiddo, and we were able to freeze eggs for him. And then he started his testosterone and he was just really happy. It actually helped a lot with his dysphoria of that he'll be able, maybe be able to have kids, because, certainly with fertility preservation, it isn't an insurance policy. It's not a guarantee. That's the tricky part about this.
Right.
But certainly it's the best chance that you can have other than trying to have a baby right now. So that was kind of the first publication of like just introducing this of like, hey, we can do this for kids that haven't finished puberty. And since then, I've had a lot of doctors reach out to me kind of from around the country to talk about different strategies. And so other people are considering this for patients, which is cool. The other publication was in pediatrics, looking at adolescent kids who were wanting to freeze sperm before they transitioned. So we had 10 kids who were before they transitioned, and then 2 who had started. One had started on Lupron, so hormone blocker, And then the other one had been on estrogen. We found that of the 10 kids who hadn't started treatment, they were all able to freeze sperm. Okay. And then the one who had been on Lupron and the hormone blocker, she had to stop it for about 5 months before her sperm
Wow.
came back. But her sperm did come back and she was able to freeze, and then she went back on it. But it is kind of a commitment. The last patient who had been on estrogen, she was scheduled for bottom surgery in 4 months. And so we stopped her estrogen, and she was also on spironolactone, which is a testosterone blocker.
Mm-hmm.
So we stopped those for 4 months. And by the time she was to her previously scheduled bottom surgery, her sperm production had not come back yet, and so she didn't freeze any sperm. But we weren't sure if we had pushed out her surgery, which of course she didn't want to do, would it have come back? So it's kind of an unknown. But yeah, a lot of people get nervous, especially for like teenage kids, like freezing sperm or eggs, of like, is it good? Like, can they do it? There's a lot of considerations. Yeah, that was, just again saying like, this can be done, right? You can try this, you can offer this to patients and families.
And I would imagine if they're under 18, they would have to have their parents' permission to do that. So it'd be like,
it depends.
okay.
So, if there are some kids who are like emancipated. So certainly with like, for, kids who are trans or non-binary, not everybody has a super supportive family, right? And so
Right.
it can get complicated, but doesn't mean that it can't be done. But that's part of kind of the struggle with the fertility community, like the fertility connections with, you need a lot of support. It's expensive and takes a while, which is why a lot of people come back to see us like after they've transitioned, right? Of like, okay, I'm stable, I'm like healthy, I'm not 17 with my family not supporting me. And so we also need to have a plan to take care of those patients too, right?
Right. Yeah, because I could just imagine. I know it's very difficult to get these sorts of services if you're,
Yeah.
a minor and don't have a supportive family.
Yeah.
Not even from
Yeah.
cost, but even like legality and figuring the ways of doing it.
For sure.
Because, I've talked to a lot of people, not specifically about family planning, but about like accessing hormones. And that same issue comes up too.
Yeah, absolutely. Yeah, so there's certainly a lot of barriers that happen. And so that's why my other research that I was working on is looking at, if you've been exposed to testosterone, how do your eggs do? How do you do when we freeze eggs? How many eggs do we get? Do they work well? So that's kind of the other research that's, we started working on, and that other groups around the country are starting to work on too, because, it's easier for most people to come and see me when you're like 27 and partnered and like want to have a kid, or 38 and partnered and want to have a kid, or 38 and single and want to have a kid, right? But then I need to have an answer for you of like, okay, you've been on estradiol for 10 years, or you've been on T for 10 years. Like, how is this going to work? Like, what are your chances? How do we approach this? And unfortunately right now it's a lot of unknowns. So,
right.
Certainly I'm asking for patients who've already been on gender affirming hormones. I'm asking a lot of like, okay, well, we can certainly try this, but we don't know if it's going to work, if your, sperm or eggs are going to come back, if they're going to be affected from long-term hormone therapy. Like, there's a lot of unknowns.
Is there any research out now that kind of like estimates like timelines of like, if you're on hormones for X amount of time, your chances of being sterile or infertile are XYZ?
There's a little bit. So it's more for estrogen. So testicles and sperm really don't like estrogen. So there are some studies that have shown that, and mostly in like animals. Okay. Just like, it's like tough there's not robust data in humans yet that if you've been on estrogen, that your sperm production might not come back. And the longer you're on estrogen, the less likely it is to come back. Okay. So certainly, freezing, if I have somebody who has sperm and somebody who has eggs, and like, who is it more important to do that for? I would say freezing sperm, because we have more data that estrogen is going to be bad for the testicle. And then we also, it's also a lot easier of a process
Yeah.
compared to freezing eggs, right? So it's like, okay, like give me one day, one collection, boom, get it in the freezer, right? Whereas freezing eggs is a little bit more of a complicated process. So that's, certainly with estrogen, we know those things. Testosterone is a little bit more of an unknown. We know that like cis women who have elevated testosterone levels, like people who have PCOS or different tumors, they still make eggs and their eggs can still function. Certainly when you're on T, your testosterone levels are a little bit higher, but we do know kind of just anecdotally, and if you see like, it's actually more published in like the popular media of like guys coming off of their T and like getting pregnant with their partner who has sperm, right? Just like in the normal way without coming to see me, right?
Right.
So, certainly that happens. We don't know if fertility is lower, right? If you're more likely to be infertile if you've been on testosterone. So there's a lot of unknowns, but testosterone seems to affect the ovary less
Okay.
than estrogen affects those. Here comes my cat. Sorry.
You don't have to apologize. I have a black cat too.
Oh, kindred spirits.
Yeah. My cat's a tuxedo cat, so she has like
Oh.
white paws and like white chest and like a little white stripe.
Love it.
So basically your recommendation would be like, I would assume would be like, if possible, look into freezing eggs or sperm before starting hormones.
Yes. So in an ideal world, right? And we don't live in an ideal world.
Right.
In an ideal world, think about doing that before you start blockers or before you start gender affirming hormones. That being said, talk to a fertility doctor no matter where you're at, because there's certain things that we could do, which sometimes involves stopping for a little while, which can also be kind of unacceptable for some people. But also, you don't necessarily have to use your own eggs or sperm. We have egg donors, we have sperm donors. There's lots of options that, even if you don't want to come off of your treatment and you don't have eggs or sperm, you don't want to go through the process, there's other ways of building a family that, we can talk about too. So, I'm more of like, let's get all, I like patients to have all the information so that you can make an informed decision. So, I think either having a fertility consult before you transition, or even like after you've transitioned, you transitioned 10 years ago, like come and see me, talk about it. If you want to have a family, there's so many different options, and we can figure out fertility treatment's kind of like okay, I have this menu of stuff. Let's figure out like what works for you, right? Because not every menu option works for everybody.
So I'm kind of wondering, like on that note, what would like a typical appointment with you look like?
There's a couple different options for me. I also do like free phone consults. So like 30-minute consultations that, and I can, give you all the info at the end, but of like calling and scheduling and just talking about your individual case. Cause, for a lot of like trans and non-binary people, like your treatment goals are different. Like your treatment course has been different. Like everybody's, your partners are different, which, what kind of, if you have a partner, do they have egg, sperm, uterus? Do they want to use any of those things? It can be a little bit of a puzzle piece. So everybody's a little bit individualized. But yeah, I do free phone consults. But how it would work for, if you're coming in to see me for a visit, we schedule an hour visit and have you fill out kind of like a patient portal so that I have your information. I'll request all of your records and kind of get your records from whoever's providing your trans care, or even just from your PCP. And then we just kind of figure out your goals. One thing that I will mention for most fertility clinics is that a lot of our EMR, so like our electronic medical records, are gendered. And that can be, we put, when we send you the email to like go and fill it out, we say like, this is gendered, like, and it is from like the EMR provider. And that's one thing, certainly for us, we use a pretty common fertility EMR. But that's something to just kind of be aware of. But I think, unfortunately, most trans people are pretty aware of kind of misgendered paperwork in the medical community, which sucks. But that's just kind of a warning. But yeah, you fill out that information and then we just have a conversation, can talk about different treatment. It's mostly counseling, finding out your story, figuring out your goals, and then talking about different options. So yeah, but we start with an hour visit and, it could just be doing a consult, just doing a one-time consult. It could be doing some testing. It could be like all the way going through and doing treatment. So I'm doing either sperm freezing or egg freezing. embryo freezing, kind of depending on your situation.
I was going to ask this question earlier, and you've kind of touched on this, but I'm just wondering, like what are some of the things beyond obviously providing services for trans people? Like, what are some of the things that like you and your office, the clinic, do to make the space like specifically inclusive and sensitive to like trans identities and experiences?
For sure. I think that believe it or not, I think that especially now, it sounds like maybe your experience was a little bit different, but certainly in our office, it's pretty non-gendered as far as kind of, we don't have like pink uteruses and, it's not like you're in an OBGYN's office, right? It's like, it's very, like, all right, come all, let's like make a baby, right? Yeah, so it's not like going into an OBGYN, because I know that can be really tough when you're like going to get a PAP or something like that. It can be, as like a guy going to get a pap smear in a gynecology office can be like an uncomfortable process, right? So certainly in our office, it's pretty like non-gendered. Certainly I think that one of the things you kind of wrote to me was like, concern about being outed if you haven't started transitioning. Yeah, which is super important. And I think that, in our office, like I said, like, if you're male presenting or female presenting, and I mean, I have people like that in my office all day. So it's not like a weird thing, specifically for people who are male presenting coming into my office. It wouldn't be a strange thing at all. The other thing that we're doing now is telehealth. So, and hopefully this will stay at like post COVID, but like right now, like we can talk from the comfort of our own home. Like I sit and do this basically exactly what we're doing right now, right?
Yeah.
And talk about your story. So that also might be more comfortable for trans people. But I think I think what I bring is just like openness and kindness.
Yeah.
That just normalize, like, this is normal. You are normal. Right? Like, you're not like this, I don't want this to come off the wrong way, but you're not like this super unique, super special, crazy person who like needs this wild fertility treatment. It's like, you're just like a normal fertility patient who's going to come and see me. And like, frankly, like, I just need to know, do you have sperm and eggs?
Yeah, treating
like,
people like they're people rather than
totally,
like you're some weird anomaly.
Yeah, you're not a weird anomaly. And it's like, I when I go and I talk to like OBGYNs or like give different talks, a lot of people get kind of bogged down in like some of the terminology and like how people identify. And I'm like, listen, because when you have couples, you can have, a crazy number of combinations, right? And I'm like, listen, let's just break it down to the ingredients. Do we have eggs? Do we have sperm? Do we have somebody who wants to carry it? Like, are we missing any ingredients? How do we get them? Right? Like, that's what it comes down to. Those are the 3 ingredients to make a baby: egg, sperm, uterus. Boom. So if we don't have those things, or if we have extra of those things, whose are we going to use? And how do we get the things that we're missing? Like, it's that simple. And if you're cis, trans, it doesn't matter. Gay, straight.
Yeah.
It doesn't matter.
Because regardless, you have to have those basic ingredients.
Totally. And then, I talk about penises and vaginas all day, right? So you also have to add like a little bit of humor, right? Like,
yeah, for sure.
Like, okay, you're going to come, you're going to masturbate in my office into a cup, and we're going to freeze your sperm. Okay. Like, that's what's going to happen.
Like, I can say that was a strange process when I went through that.
It's a totally strange process. And like, doesn't matter who you are, it's strange, right? But it's like, that's what happens in my office all day long. So you just, you bring some humor to it, and you just like, it's just normal. In my world, it's normal. So I guess
it should be normalized.
It is normal.
It is really normal when you think about it. It's just very taboo for some reason.
Yeah, I think it's getting better, but I just try to like, I have the mask, my COVID mask that I'm wearing right now has uteruses on it, and it says "at your cervix," right? And I wear it in public, like at the grocery store, and sometimes people look at me. I'm like, listen, half the people on the planet have one of these, so
it's like, it's not weird.
Mm-hmm. And you came out of one, so yep, that's a uterus.
So kind of like moving forward, we talked a lot about the consultation process. I'm wondering, like, what would a like, I kind of have an idea from my own experience of what it might look like to sperm bank, but I'm wondering, like, what would that process be like once somebody was like, okay, I do want to freeze my eggs or my sperm with you?
Yeah. So the way that it works is, so we get you set up with the lab, and basically you just like, you come into our lab. We have like a separate like little waiting room. So you go in, you get your stuff, you get a cup, you go into a room, and you masturbate into a cup. Okay. So that's kind of the standard way of doing it. And then we would go through and we'd freeze those sperm. For some trans or non-binary patients, there can be a lot of dysphoria associated like with the penis, right? And so maybe you're not comfortable masturbating. There are other ways that we can talk about getting sperm. So like I have a wonderful urologist who I work with, who can talk about like surgically retrieving sperm if like, you know, masturbating and ejaculating is like not something, either you can't do it or can't do it physically, or just, you know, it's so dysphoric that it's not possible. So again, even if you think like I can't come in and masturbate in a doctor's office, that's okay. Come talk to me. We can also do home collections. There's like different things that we can do to make it more comfortable, including like giving you some anesthesia and like getting sperm in a different way, right? So there are lots of options that are available. But like for kind of run of the mill, which it sounds like you did as well, just like coming in and do the thing in the office, depending on your family goals, we can figure out like how much sperm should we freeze, right?
Okay.
So this is where it's good to have an idea of like what kind of partners do you think you would have in the future? Like, do you think they'll have eggs, sperm, uterus? It's okay to totally like not know or say everybody, you know, like I have no preference, right? So then we can, you know, okay, then let's freeze a lot of sperm to keep our options open. Because certainly if you want to do things like inseminations, so say you have somebody who, you have a partner who has a uterus and eggs that they want to use, want to get pregnant, then we would be, you know, we need more sperm because you're trying every month, just in kind of like a more typical way. If we're doing IVF, where we're like taking eggs out of somebody's body, we're taking sperm, we're making embryos in the lab, and then transferring embryo into your uterus or whoever's uterus, then we need less sperm. Okay. But that process is more expensive, right? So it can help kind of figure out your flexibility. So more is not necessarily better. It just depends how much sperm you want to have. So that's something that we kind of strategize.
So it just kind of depends on like how you go about doing it and how many kids you might want to have. Like,
exactly.
All that kind of
Exactly.
stuff.
Exactly.
Okay.
Yeah. Yeah.
How does the process look for freezing eggs? I know you said that that's, you know, more intensive. It's much more expensive.
It's a little bit more involved, because it involves basically what happens in the ovary every month, is you have like a pool of eggs, and the brain sends down a hormone called FSH, and you have this pool of eggs that hears that message. And what the brain is saying is, hey, it's the beginning of the month. Somebody needs to ovulate this month. And what happens is you have this group of eggs, they compete against each other, and only one wins and ovulates and the rest of them die away. Okay, so it's really inefficient. We're like wasting eggs left and right. You know, people who have ovaries just wasting eggs. What we do in IVF, just like in a nutshell, or in egg freezing, is we give a bunch of that hormone to try and get those eggs to grow as a team. Okay, so all we're doing is making one cycle more efficient. Okay, we're not using any eggs that you wouldn't use anyway. I often have people ask me, like, do I go through menopause sooner because you're taking out eggs? And the answer is no, because I'm just allowing more eggs to survive, okay, instead of dying away. So it's this big elaborate trick on the ovaries, and the trick takes some time. Okay, so it involves kind of different hormones. So it takes, you know, from your first consultation, it usually takes 2 to 3 months to be done with the process, because there's like some lead in time. We have to do testing. The process itself of like, actually, if you're like, you know, Googling like, what do you do for egg freezing? The stereotypical part is like doing injections. That part lasts for 9 to 14 days. Okay, so it's not that long. It's like, you know, a week and a half, 2 weeks. So that part that's the most intense part, where you're coming into the office every like 2 or 3 days for blood work and ultrasound. Also for, again, going back to like things that could be triggering, the way that we normally monitor is with transvaginal ultrasounds, right? So if you have dysphoria with your vagina and, you know, or not sexually active, you know, with using your vagina, that can be a challenge. And so that's another thing that we kind of strategize, like, is this something that we can try? Okay. Or do we need to think about other ways of monitoring? So those are other kind of things that come up in the process with my like trans and non-binary patients of, can we do this in our usual way? But yeah, that process, generally speaking, takes, you know, a couple of months to go through from start to finish.
Yeah, and with sperm freezing, you could do that the same day. So
Totally. And you
much,
can do a
much, much
couple
quicker.
sperm freezes. Yeah, it's a
Hmm.
lot quicker. So, and I think you had asked me about prices too. So,
Yeah, that was actually my next question. Yeah.
perfect. Let's talk about it. Okay. So in our clinic, and this can vary from clinic to clinic, but in our clinic to come in and do a sperm freeze, it's $190. Okay.
Okay.
And so each time you come in to freeze sperm, so if you're coming in a lot more, if you come in 5 times, it's $190 each time because we have to process the sperm,
Okay.
aliput it out, freeze it. Then storage fees. Okay. So in general, storage is about $500 a year, kind of depending on the clinic, whether you're transferring it to like a long-term storage facility where that's all that they do. But it is a continuing yearly cost. So if you're like 18 and you want to have kids when you're 40, right, you want to think about 12 years of keeping your sperm frozen. So that's something to keep in mind. I kind of mentioned egg freezing is more expensive, right? The medications are expensive, the process is longer, it's certainly more intensive. So that's about $15,000. Okay. And that's going to vary clinic to clinic
Sure.
and kind of region to region, but I think that that's a pretty good ballpark. And then same kind of storage fees. So about $500 a year. Yeah, certainly for egg freezing, it can be tricky. There are different ways, there are different grants that can maybe help pay. There's a company that I really like called Future Family that they're based in California that give like loans and are very LGBTQ friendly. I'm hoping that as time goes on, we'll have more resources for trans and non-binary patients to help pay for egg freezing and also for sperm freezing because it's expensive. It's really
And
expensive.
I would imagine that insurance covers very little or nothing.
It depends. It really depends. I
Mhm.
just recently had a patient who they covered as many sperm freezes as she wanted to do. So it really, really depends. In the Northwest, in the West, we tend to have more insurance coverage. The tech companies all offer fertility coverage, including like for egg freezing and IVF. But that's like a
Wow.
very unique thing.
Yeah.
Most places in the country, you're not going to have coverage.
Yeah, because I know when I did it, I think my initial consultation was covered, but
Yeah.
everything else was out of pocket.
Mm-hmm. And we're doing a lot of we're trying to infertility or like risk of infertility is a medical diagnosis. And so we're trying to get more legislation passed where insurance companies are required to cover. So there are, I think, 13 states now where it's mandated that fertility coverage is provided. So it also depends on your state as well. But
Right.
certainly that's not a barrier. It should, again, coming back to like, just don't think that it's out of reach. Maybe
Okay.
find out if it is,
And kind
at
of
least get some
as,
counseling and talk about,
yeah,
even if I don't do it now, what
just,
does it look like later?
and as we were talking, I was wondering, like, somebody might freeze their eggs or sperm for a, a multitude of years.
Mm-hmm.
Is there any research out there that shows, like, does over time, I imagine it would degrade?
Yeah,
Um,
expiration dates.
yeah.
Yeah, really good question. So we like flash freeze them in liquid nitrogen. So sperm has been frozen since like the 1950s. So I mean, it's been 60, 70 years. So there's still sperm frozen that's viable after that length
Oh,
of time.
wow.
The longest frozen embryo that's resulted in a baby was frozen for 23 years. Okay.
Wow.
Eggs, we've only been freezing since outside of an experimental protocol since 2011. So
Hmm.
that's a newer technology. The egg is actually the biggest cell in the body. So it's full of water. So it was really tricky to kind of figure out the best process to freeze them. But the data now is showing that, certainly eggs that have been frozen for 10, 15 years still function. So, and we have no reason to think that they would get like eventual freezer burn. So, but certainly for freezing eggs is really challenging. Definitely go to a center that does a lot of egg freezing. That's one, that's freezing the egg, the cell itself is really challenging. So just make sure that you go somewhere that does a lot of it. But yeah, no expiration dates that we know of so far.
Yeah, that's great to hear.
Yeah, great to hear. Well, especially for like my adolescent patients, right? Who are like
Right.
14, 15, 16.
Yeah,
Yeah.
because I could imagine for some people they might be frozen for 10 to 20 years, just depending
Absolutely.
on their timeline.
Absolutely. Yeah.
Because I was just wondering, because like mine have been frozen, thinking now like 5.5 years, but
Oh
no,
yeah,
it's
they're
fine.
so good. They're fresh. Don't worry about it.
So kind of speaking of like some of these, technological advances in some ways, like I'm wondering, like, what do you think, or what have you seen? Like, what is the next new
Yeah,
innovations in this sort of
totally.
technology?
So it's a great question. So one of the programs that we started developing at Pitt before I left, that's still going on, is freezing testicular tissue or freezing
Hmm.
ovarian tissue for patients. Okay. And we've been doing that in a like studying doing that for cancer patients for a while. So
Okay.
since like the mid 2000s. And then expanding that to the trans community just happened in like the last year or two because it makes a lot of sense. If you know, maybe you've been on estrogen for a while and you don't want to come off of it, right? So maybe if
Hmm.
we took testicular tissue, we can make sperm in the lab from the tissue itself. Like we can get those, you know, cells out of the tissue and do it in the lab. And then same for somebody who has eggs, right? That or has ovaries. So maybe we can take part of that ovary out so you don't have to come off of your testosterone and make eggs in
Okay.
the lab. That is kind of like the future goal. Okay. It's not there yet. Right now, for certainly for testicular tissue, we're further away from the technology we would need to do that. For ovarian tissue, it has been successful, but by reimplanting it into your body. So for trans patients, that doesn't make sense, right? If you're taking
Right.
tissue out because you're like gonna go on T and then you don't want to put the ovary back in, right? Because you're like, listen, that's the whole point. Don't want this estrogen. So we need to have that technology where we can do it in the lab. So that's people
Okay.
are working really hard on that. So that's something that maybe, you know, 10, 15, 20 years from now might be a real viable option.
Cool.
But I think for trans patients, that would be amazing. Certainly for, you know, people who are having their ovaries removed or testicles removed. I mean, we're just getting rid of them anyway. Wouldn't it be amazing to just like put them in the freezer and, you know, not have to do this whole like egg freezing, sperm freezing process? So
Right.
I think that would be like the amazing thing, but it's
A
a little
little
bit
ways
far away,
off. Yeah.
a little ways off. But yeah, that's something to like stay tuned.
And
Yeah.
I've also heard some people have been getting, cis women have been getting uterus transplants.
Yeah.
And
Yeah.
that has prompted discussion from trans women if that would ever be a
Certainly.
possibility.
Yeah.
But I would imagine that would be incredibly complicated. So I
It
was wondering
is,
if you could
it's
comment on that at
possible.
all.
It's for
Okay.
sure possible. The patients who are having uterus transplant for the cis women are women who either were born without a uterus. So, I mean, very similar to like trans woman who she was also born without a uterus, right?
Right.
So, certainly theoretically, it could be done. It is a grueling process,
Mm.
okay, that involves a donor. So there are some places that are using like live known donors. So a lot of times it's like a mom donating to their child. Some places are using deceased donors. So kind of similar to like if you got a kidney transplant or a heart transplant from somebody that you didn't know. You have to be on a lot of anti-rejection medications. The surgery itself takes like 8 hours, I think, plus. It's a really intensive surgery. So I don't know that it's something that would be really widespread or something that a lot of
Sure.
people would be super stoked to do. But certainly, I mean, it could be done. It's still done in a very controlled, studied fashion. Like and there's only a couple places in the US that are doing it. But certainly it's something that, yeah, theoretically, yeah, trans women could have a uterus implant.
That's exciting because I have
Cool.
I have friends who would love for that to be a possibility.
Yeah,
Um,
yeah.
I would be interested, but I don't think I would want to go through
It's a
the
big
the
surgery.
surgery of.
And anti-rejection medications, there's risk of, you know, rejection and, you know, so it's a big
Right.
undertaking for sure. But for some people it's worth it.
Yeah.
So, and, you know, in my mind, I don't think that there's really a difference between, you know, a cis woman who's born without a uterus and a trans woman who's born without a uterus. So,
So maybe we'll see that in
yeah.
the future as well.
Again, stay tuned. Stay tuned. Yeah.
Well, that was pretty much all my questions. I think you captured everything. So, I just wanted to see, like, is there anything that we didn't touch on that you think would be important to share, either about
No.
yourself or the work you do, or?
Well, I think that kind of my takeaway for, you know, any of my like trans non-binary patients is, you know, the fertility world, we we make families in what some people would consider to be a non-traditional way regularly, right? With donor eggs, donor sperm, surrogacy. It's just, embryo adoption. We're just kind of a different field of medicine. So don't be afraid to come and talk to us. And I think, especially right now in the world of telemedicine, I mean, you could live in Florida and do a consult with me right now. Be a little bit harder to do treatment, but we can make it work. So, or at least get some advice and things like that. So hopefully that will stay around so that it's easier for, trans and non-binary people to find specialists who they feel really comfortable with. But I think generally speaking, don't be afraid to reach out to your fertility clinic. Another good way too is most fertility clinics have a little tab that says LGBTQ families. Mm-hmm. That's a good indicator of okay, this is a safe space. And just call them and be like, hey, I'm trans, and get a vibe on the phone, right?
Yeah.
See if it feels right. But don't be afraid to reach out. Information is power.
Yeah, and I've been seeing a lot more of the LGBT health subsections on websites, even in just the past 5 years since I originally went.
Yeah.
So
also use your endocrinologist, your your provider who's doing taking care of gender dysphoria, and just talk to them and be like, hey, I'm interested in fertility. Make them do some of the research. So I have people all the time who reach out to me, and and Seattle Children's Hospital is their gender center is putting together a whole fertility preservation pamphlet and having these are the providers that we would recommend that you come and see. So ask your providers too. They think about this. This is having a family is important for a lot of people. So it's an important quality of life issue. So, don't be afraid to advocate for yourself and ask questions about that.
So kind of the closing question, how would somebody get in contact with you if they wanted to schedule a consultation?
Yeah. So I'm at Pacific Northwest Fertility in Seattle. You can check out our website. And then also I'm on Instagram, dr.rothenberg. So, certainly through the website, you can get our phone number. You can go through the portal, schedule a new patient visit, schedule a free phone consult with me if you'd like. On my Instagram, I don't give medical advice. Okay. So, it's not an awesome way to get medical advice, but certainly a way to reach out. Or if you say, hey, I'm in St. Louis, who should I go and see? And I can help do some of the research too and kind of find out. So, and it's a small community. There's only about 1,200 fertility doctors in the whole country. So it's a small little world. I can help you find a good home. But yeah, I'm happy to see you via telemedicine, right now. Hopefully that'll stay around, but certainly in the COVID world that we live in, take advantage. If you're in the middle of nowhere and don't know who to talk to, schedule an appointment with me. Happy to chat with you. My partner, Dr. Broughton, also does a ton of LGBTQ care. I focus a little bit more on kind of trans and non-binary patients. She focuses a little bit more on, gay men and the complexity of, surrogacy and all of those things. But we are interchangeable. So, I also see gay men, and she also sees trans and non-binary patients. So between the two of us, we'd be happy to see you. Thanks for doing what you're doing. This is truly, truly amazing for people to have such an amazing resource and just not feel alone and get amazing information. So keep doing it.
Thanks. And of course, thank you for taking the time to be able to do this in the first place. Anytime. I talk about this all day, every day. I can tell that you're very knowledgeable and very passionate about what you do. So. Oh, thanks. I appreciate that. That. And my dogs behave themselves. Yeah, I didn't even hear them. I know, they're sleeping. It's perfect. It was such a pleasure to meet you. You too. Again, thank you so much to Dr. Rothenberg for taking the time to do this amazing interview. All this information she provided, I know would have been very helpful for me when I did fertility planning services a little over 5 years ago. So I'd be curious to hear your reactions. What are your thoughts on the services that she provides? Would you consider scheduling a consultation with her, or maybe at another fertility planning clinic if, she's not local for you? I'd be curious to hear any experiences that any of you may have previously had with seeking or obtaining fertility planning services. As always, thank you so much for watching, and I hope that you're staying as safe and healthy as you can during these tough times. If you have not done so already, please be sure to give this video a big thumbs up and hit that subscribe button and notification bell. And of course, Tipsy and I love you all and wish you well. Bye for now.